yes, so it's a pleasure to be here today. And when I got this invitation, I thought as much of it being an invitation that is quite coming at the right time. And it's a pleasure. Once more, I'm sure you guys, my introduction has already been made. My name is David Innocent, PhD researcher at University of Port Harcourt, and AI, artificial intelligence, is one of my very massive specialty, and that's why I founded Synalytics, which is an artificial intelligence company, and then also Centisini, which is kind of a medical research company. Now, that's by the way. Now, whenever we talk about AI in medical research, there are quite a lot of things that comes to your mind, right? So many people, immediately you mention AI in research, you kind of feel like they're talking about plagiarism, or they are talking about generative AI, or kind of generating some insight. But what we want to do in this session now is I want to use this opportunity to address how artificial intelligence plays a role as a researcher. As a matter of fact, I have published a quite number of papers, particularly around systematic reviews, meta-analysis, and machine learning papers, a volume of machine learning papers. And one of the things I've got to realize is that there is a lot of potential when it comes to research in artificial intelligence. So it is not something it's not something you need to see as an agent that wants to take out your opportunity, but rather you need to see that there are so many opportunities when it comes to artificial intelligence and how it intersects in research, not to talk of medical research. So that is what we're going to be talking about today. So I want you to open your mind. You need to be very open-minded, particularly in terms of this particular sensitive topic, because there are myriads of confusion that comes whenever you mention AI and you affiliate it with research. But this session is one that is going to introduce the opportunities that comes with it, more of an introduction of what you can do with respect to that. So now, one of what I'm going to look at now is we are going to talk about some of the emerging skills gap when it comes to artificial intelligence. Because every day when you open, if you're a researcher here, if you're somebody that is passionate about research, I'm sure you might be checking what is happening in several journals. Because a lot of medical students, one of the problems we have is that we don't put our findings out there, and that's a very big issue. You're a student and you think that the only person that can publish an article is your lecturer, and that is wrong. You need to see opportunities when it comes to research, and that is where artificial intelligence creates massive room, right? Now, every day, over 3 million biomedical papers are being published, and the truth is that most traditional papers cannot even really keep to that pace, and that's why most medical curricula offer no structured AI training. You might not really get to have that structured training when it comes to AI in school, because your lecturer already assumes that no, AI is bad, AI is this, AI is hallucinating, not knowing that AI itself is a research innovation that somebody did. The same way you're doing your Hello, can you guys hear me?
Yes, sir, we can. Loud and clear.
Yes, I thought my
Yeah, we
network
can hear
went
you.
off.
Loud and
Sorry.
clear.
Okay. All right.
No, we
Thank
can't.
you so much. Okay. All right. So what I'm saying is, so the same way you're doing your research in school, trying to publish a paper on cardiology, trying to understand the association between two diseases, to make inference. That was the same way somebody created a chat bot or created an innovation that can help you drive your research process much more further. So we need to kind of understand the skills gap, because research volume is really doubling, right? People are publishing papers every day. Personally, we publish almost every 3 days, quality papers where we write, argue, send it to journals, take feedbacks, and then do a lot of critique on that, right? So the problem we are having now is that AI literacy is absent in our medical curriculum. we don't really get information when it comes to these LLMs. We are not really taught about how to properly incorporate it into what we want to do. And I believe that is what this particular training, this course or this initiative is trying to address. All right. So that's why even in terms of when we look at the link between physicians, so many doctors and data scientists, you see that it's quite short because a lot of people are focusing more on only clinical practice, whereas some other people somewhere is focusing only on data. But that's bridging that gap is what that is really going to give us that enhancement. All right. So that's that. Now, to introduce artificial intelligence in research and the medical research, one of the things I need to let you know is that AI is not really replacing researchers, okay? And it's something that is going to augment capacity at every scientific process. So now let's have it this way now, because somebody might be asking, okay, what is actually this artificial intelligence that we're talking about? When we talk about artificial intelligence, right, as an introduction, now pay attention. I want you to pay very rapt attention to what I want to say now, because this is me introducing artificial intelligence now to you. Now, when we talk about artificial intelligence, one of the things we need to understand is that artificial intelligence is any process that tries to mimic human experience. Now, let's embrace that layman's definition of artificial intelligence. Any type of technical process that tries to do what? Mimic human intelligence. So that is what artificial intelligence is. Now, if I'm just going to just leave you now with this definition, I think that's really enough, because when I talk about AI in medical research, the first thing somebody needs to unpack, you need to unpack what is artificial intelligence. You talk about any process that tries to mimic human intelligence. Now hold it there. So since it's any process that tries to mimic human intelligence, right? You might have your own broader definition of artificial intelligence, maybe science of techniques, a lot of technical jargon and all of that, right? But then what we just know is that once I say, okay, give me this cup, and then something automatically does it without me manually picking it up, that is what? An artificial intelligence inspired action, right? So good. Now, let us look at research now, because a lot of students, most times, we just focus on copying notes in class, doing assignments, and we don't really apply so many of what we learn into real technique. Now that you understand what AI means, if you're looking at research on its own, medical research implies what? You're trying to do what? Gain new knowledge. You're trying to gain new knowledge. Any technique, scientific process or data collection, approach, maybe you do data analysis that informs you to gain new knowledge is what research is. Research is all about new knowledge. Now, if you're not trying to marry AI with research, what this slide, because this is a very critical slide, what this slide is trying to say now is that artificial intelligence being introduced to your school, being introduced into your curriculum, means that at every point of your research, because for you to do research, you want to gain new knowledge. So what are the approaches it takes you to gain new knowledge? From your data collection step, from your literature searching, from your data extraction, getting papers from repositories like PubMed, Google Scholar, JSTOR, Scopus, Web of Science, Cochrane Central, most of all those repositories, right? All those techniques that you are manually doing, AI that we are introducing to you in this particular workshop means that all the facilitators want to tell you how can artificial intelligence be applied in all of this process. So the question that begins to come to your mind now is, oh, wow. So now that I understand the definition of research, medical research, which is gaining new knowledge in the field of medicine, in the field of cardiology, you want to know how, maybe you want to understand let's say, for example, you want to understand hypertension in pregnancy, right? Preeclampsia. You want to do a research on hypertension in pregnancy, for example. That's medical research. Now, all the process that it will take you to get your paper, do your study, go into the field, do everything, and then submit it to a journal and it's published, you can now come out and say, I am now the first person to publish that hypertension in pregnancy is attributed to 700 women in this community. What we are talking about in this session is how can AI help in reducing the number of time you spend in doing that research on hypertension in pregnancy. That is what this session is all about. So basically, what we want to walk you through now is, okay, at this stage, how can you apply artificial intelligence? At this other stage, what are the tools that will be very imperative or pivotal for you to make your work easier, to mimic that manual approach that you want to take? So rather, we will need to use its process, which is called artificial intelligence, and artificial intelligence to make that process easy. That's why most time when we mention AI in research, so many people are already thrown blank. They are only seeing the limitations, but they don't see how to exploit the positives in it. And that is what we are trying to address here. Now, take, for example, if you look at this slide and you find out that what we have several stages in the research pipeline. We have the literature review and evidence synthesis. I focus more on evidence synthesis. So I mean that I've published a much more higher number of reviews than other types of research, right? Because I spent my early career, that's the early career part of my research, publishing reviews, several repository system. When I mean reviews, I'm talking of systematic reviews, talking meta-analysis, talking scoping reviews, and narrative reviews, even methodological guidance and all of that, right? So it means that across this process of reviewing literature, desk-based studies, staying at the comfort of my home, doing something phenomenal, there are ways to make it that where artificial intelligence comes in to make my work easier. Now, you can also be doing clinical trials, right? There are also other stages in medical research, like clinical trials. There is also a way whereby AI optimizes, some of what you do. Maybe let's say, for example, you come into the field, there are some tools, some gadgets that can make your data extraction process much more easier. And these things are inspired by what? Artificial intelligence. It is not human intelligence. What I mean by that is that it is something that you outsourced that human process of performance. That means a kind of an object is what is doing it. So when it comes to predictive analysis too, artificial intelligence is playing massive roles. We're going to look at some of those. When it comes to medical imaging, of course, we know that very well. AI is playing a lot of massive roles. In short, as a machine learning engineer, we engage in developing some sort of models, training models that helps in identifying maybe some kind of maybe diseases or skin manifesting conditions. It could be anything, diabetes, maybe you want to put in query some parameters. There are machine learning algorithms that are really very good in terms of this action, all right? So even in drug discovery, machine learning has really gone far. You remember when they would talk about how, patients with HIV are having are being passed through some kind of, mechanisms, AI mechanisms, where that artificial intelligence mechanism tries to remove undesirable characteristics from their cells. And these are all AI-inspired approaches that you need to understand. So you see that when we talk about AI in research, we're not just saying the layman in school is thinking ChatGPT. No, that's beyond that. AI has been in existence. So a lot of people think AI in research is ChatGPT, or you wrote with Claude, or you wrote with 1, 2, like that. That's not just AI research. AI research has been, we'll be having phases of artificial intelligence development, right from machine learning, to deep learning, to generative AI, and now we are even entering transformers and much more advanced computations and all of that. So that is the application of AI in medical research and even in medical interventions, not even across medical research, even in medical intervention. So it's kind of an augmentation, sort of replacement. And at every stage that where if I introduce some of these tools that it's being used for AI in medical research to you, you need to know that they are not kind of something that is going to replace you. You still need to show some kind of expertise in understanding what is being done and then see how to play your own role. Of course, I'm sure there will definitely be somebody who will talk about the limitations and all of that and all that. Okay, so that might be beyond the scope of my conversation here. But basically, what you need to know that there are tools. I'm introducing you to relevant tools that make your work very exceptional. So at every stage, there are what you need to know is what are those right tools? How do I learn how to use those tools? And then how do I do what? Applies them. So AI handles all of this at scale, and it helps researchers drive what? Insight. Now, what's actually the modern AI toolkit? Because I think I kind of went far. So what's actually the modern AI toolkit now? So at your stage now, probably as a medical researcher who is maybe performing some kind of desk-based research and all that, there are AI tools that are really very good, particularly in terms of literature review writing. And when it comes to literature review writing, every physician should be fluent with some of this AI-powered platform to accelerate your discovery. Gone are the days when you would tell people, oh, don't use AI to write it and all of that. What we should be telling you guys now is how to use AI and also how to apply your reasoning. Because the truth is that a lot, in short, 90%, if not 99% or 95%, that's good statistics, right? I'm not just going to state that, but I'm just going to kind of give you an inference that are all using what? Artificial intelligence in one way or the other. So where we should be channeling our energy now is how do we ethically use these tools to minimize these tools replacing our thoughts? That's why I recently published a paper on ethical publishing and plagiarism and use of artificial intelligence. So some of these papers, some of them are even currently on review, right? And then what you see is that there are tools that you need to use in medical research. When it comes to medical research, literature review is something that is very paramount. We're not talking about literature review here, but you need to know that literature review gives you the go-ahead order to know where to you will do your new research. Because if there is no gap in literature that's identified, you won't have the capacity to do your literature review. The literature review means that, okay, you want to, there is gap here. I find out that this place enough research has not been done here. Okay, how do we close this gap? How do we address this gap? How do we come in here to make some kind of beautiful inference? That's what literature review does. So what are now kind of some of the tools that helps? We have the Jenny AI, really very helpful. We have ChatGPT, we have Cloud, we have Gemini. So we have so many of them. There are many of them. I do post so many of these, particularly on my LinkedIn page. You can always check out my LinkedIn, David Innocent, and I do post so many of these things, and kind of guide researchers on the ethical use and also how to kind of use it to. Now, aside from that, also as somebody who is in medical research, when it comes to evidence synthesis, marrying your evidence together, right? There are tools that like Ryan, right? There's a tool like Ryan, particularly, okay, if you're somebody that you do systematic reviews and meta-analysis, sometimes you might want to get a lot of studies from databases, and then you want to extrapolate evidence, summarize evidence to answer your research question. Of course, you find out that without the help of AI, it's really going to slow you down now with the volume of tasks that is being expected. Because the reason why so many things are not really changing now, it doesn't look like work is all getting easier, is because with AI now, a lot is expected of you. You're expected to do more, right? So that means for you to screen these tools appropriately, there are tools like Ryan, Covidence, Distiller SR. There's AS Reviewer too. There are many of them that are actually out there, right? So what these tools help, they kind of put it in place. That's when you extract this information from the article, you can now use it to do or summarize your evidence. When it comes to reference management, we have Zotero, Mendeley. These are automated tools. They are still AI tools, because the fact that you're not the one manually doing it and the computer is doing it for you, it is artificial intelligence. So most of us here as researchers has been using Zotero. So it means that you'll be using AI because it's an artificial intelligence tool. Now, we have many of them also when it comes to paraphrasing, like QBot, Stealth, many of them that academic researchers, even medical researchers do use for their work. So for data analysis, we have Python, we have R, we have SPSS. These are just technologies, AI technologies that are really very important. So it depends on your understanding of artificial intelligence now. So for you to know that they are all tools that support. Because if not, if you're not using a statistical tool like Python, maybe that has integrated, so many IDEs now has AI components integrated into them, right? The one I mean by AI, more like generative AI, because people think AI is ChatGPT. It's not. It's not just. It is not just ChatGPT. Right? AI is not just ChatGPT. ChatGPT is just a type of AI, which is generative AI. That's what it falls under. Right? When you pick up your phone and you look at your screen, and automatically your phone detects your face, that's artificial intelligence, right? That is as a result of what? Deep face. That's what we call what? Deep learning. So it's also part of what? AI. So anything that automates your task, because you wouldn't want to start picking up your questionnaire in your SPSS and analyzing it one by one. You need a tool that can run through it faster and make it easier. So we need to have a proper understanding of what it is and knowing how to do what, apply it. So these are data analysis. So there are so many of them out there too, you know, that are generative, that still makes it much more easier and all of that. Some things like Cloud Code. Cloud Code is really very good. You know, you can use it for data analysis, optimize your workflow, make your life so easy. And then your own role is to now inspect, checkmate, and make sure you cross-check and put in your own human input. Now, we also have others like Elicit, Consensus, ResearchRabbit. There are so many lots of them. Like you could always visit some of these portals. You know, they can always make your research process much more better as a medical practitioner. Like it's really a very, very massive tool that makes everything really easy for you. Now, the question is, I'm just going to tell you something after you've now understood these tools now, because the idea as a medical researcher now is for you to move from your research question to publication, right? You don't want to just publish, right? You don't just want to have yourself stocked up in a particular work. So there's kind of an AI assisted workflow, you know, that compresses timeliness and elevates the quality without compromising what the way you go. So, for example, now we have for research questions, there are tools that can help you generate good research questions. ChatGPT, Cloud. These are more of everyday tools we all use. I'm sure most of us here might even know better than I do in terms of how to even generate, you know, topics and all of that, play with it and all of that, right? So from your journey, what this slide talks about now is from the point of you generating your research question down to your manuscript writing. These are some of the tools you can use at every stage. Now, let's say you now want to start your literature review search. There are AI tools like Elicit, Consensus, ResearchRabbit. They are really, really very, very helpful in terms of how you perform your search. You know, you want to search this database, you want to search that repository, you want to get some kind of information, you want to basically anything, most of give you a LinkedIn head suggestions, you know, make your job, your life at least easier, right? But then the one of the things I do tell early career researchers is that as much as you're automating your task, you need to be really very much involved, because we are no longer in the generation of maybe being we're not in the generation of answering questions. This period now is not a period of answering questions. You don't go out there asking somebody who caused this, or who is the owner of this, what is the causes of so and so. What we are in the generation of now is how to ask proper questions. We've moved from answering questions to knowing how to ask proper questions, and that's where prompt engineering comes in. As a matter of fact, I recently published a prompt book for researchers. That is the best prompt book ever anybody can use for systematic review, because it doesn't just leave you with AI, right? It grinds you on the manual knowledge, understanding how to properly ask the right questions, because we're no longer in the generation of answering questions. Gone were the days, maybe 20 years ago, 10 years ago, you will be asked questions, exams will be set for you, to write. These days now, almost everything you want is on the internet. The problem now is, do you know how to ask questions? So now is the time for us to learn how to prompt better. That's what we should be teaching students now, how to prompt better, how to manualize the output, how to contribute and screen the cross-check the relevance of it, because we can't leave students with only, don't use ChatGPT, don't use Claude, and then we don't even provide any invention for them. It's going to be wrong, because if you're here and the only thing you're looking at the advancements in AI, you're only looking at it from the limitations part, you're just wasting your time, because more will happen. And this is just a tip of the iceberg. So we shouldn't be left behind. What we should be doing now is, how do we improve with this technology? And that is the reason why I've released the ultimate systematic review prompt book that takes you from zero. It doesn't just teach you how to, it teaches you how to reason and apply your skills. So you can always check out scientisini.com and you get that prompt book there on my website. Like, it's really very outstanding. Or you can reach out to the facilitators, of course, they will definitely be very helpful with that. So that is based on literature search, right? So we need to know how to ask proper questions in terms of screening. Now, when it comes to screening, another stage of your research, now we now have tools that help us in extracting information from those articles. As a published author, when you gather 10 papers, 20 papers, if it was in the 1970s, maybe your lecturer might tell you, there was a time when I had to go through all these papers one by one. That time is gone. It's gone. Nobody has that time now. What we need to know now is, how do we accurately extract all the relevant insights from these 20 papers? Which tool will give us that confidence in doing it? How can we be able to do or screen these papers and be sure that we are right? That's why as a machine learning engineer, we also engage in developing technologies that helps in screening papers, helping providing more accuracy. Because if you look at the way this whole generative AI thing is turning out, you see that accuracy is increasing. The accuracy is really increasing. You look at image generation is on another level now. That was not how it was, say 4 years back or 3 years back. So we need to find a way to incorporate ourselves into this process rather than scrambling around with the limitations and not even bringing out their own invention. Because it's very funny that so many people are limitation minded, but then they don't even produce any innovation. You don't have any technology, but you're only relying on the limitation. But it's still important for you to know the limitations. It's still important, actually. But then we need to be very open-minded and ready to do understand how to use the tools properly. And that's why if you're attending this workshop by Internal Medicine Group Nigeria, you're doing yourself a very good thing, because this is a workshop that is coming at the right time. It's coming at the right time. And this is an opportunity for you to listen attentively to the speakers and, of course, get massive, massive insights from them. So that's for screening, Ryan, Covidence. For data extraction, we have Distiller, we have ChatGPT, really outstanding. If you know how to prompt, if you know how to package all your papers in a zip file, put it there, and then you get the right prompt to get all this information, then cross-check all those papers, you're already out for victory. That's why you need to get that prompt book. It is really going to be very, very important in your evidence synthesis career. Now, in terms of analysis, data analysis, like I said, your definition of artificial intelligence shows that tools like Python, R, SPSS all qualify. They do qualify. There are other tools like Julia. There are so many of them, right, that are used in analysis. So at that stage also of your manuscript writing, you might want to use Python. Of course, like I said, there are integrated development environments where you will put your data set. It can give you options to use AI to automate and all of that. So these whole LLMs are integrated in almost all the platforms now. So where we are lacking now is how to now ask the proper questions. And that's why if you don't ask the proper questions, your output is going to be generic, and then you're going to be more susceptible to failure in terms of the output. So you need to make sure you always get the right tools and that's really going to support you. Now, the next part of this conversation now is the manuscript writing, right? So I do recommend researchers to be really involved in writing the manuscript. So these are AI tools that actually assist. But then it's always good for you to know how to manually write, always manually engage. The essence of this session is to tell you the tools that help in this process, right? But then also it's important for you to know how to write. Whenever you want to start your research, learn how to understand the basics first before you start using AI to automate your medical research tasks, because we don't want to produce findings that might lead to clinical complications. So that is why we need to really abide by ethics in terms of what using so many of these tools in what medical research. Now, for publication, that's your reference management. We have Zotero, Mendeley. These are all AI tools because they do the work for you. Kind of they automate it. You understand? You're not the one doing it. So it's classified as what? An artificial intelligence tool. So each step is associated by purpose and kind of helps you as a physician researcher to complete your rigorous process in a fraction of traditional time. So that's my advice as a medical researcher to you. You need to use the AI responsibly. Very massive introduction for you guys. AI is just kind of a co-pilot. It's not an autopilot, right? Human oversight remains the non-negotiable foundation of credible research, because for you to do credible research, you still must be involved. And just like we said, a much more majority of what you'll be doing is to understand how to prompt, because there are so many jargon outside and many people are making mistakes. You are making mistakes. You're not getting things done. You're not getting the publications. You're not getting the numbers. You're left out. So you need these tools. You practically need these tools for you to do it. You need the right prompt. You need the right guidance, right? You need this information to now know how to apply it in your conversation. So you need to verify all your outputs. Because literally, if I prompt anything on GPT or Cloud on it, of course I have to go through it, ask questions. Like we said, this is a generation of knowing how to ask questions. When we say knowing how to ask questions, it's prompt engineering. That's what it means. We are no more answering questions now. It has passed. AI has solved that. So this is our opportunity to do what? Ask questions. Now, the question now is, who can ask the better question? If you cannot ask the right question, you're going to get the wrong output. But if you can ask the right question, you're going to get a better output. So, of course, you don't need to impute your patient's data into public AI to please don't do that. Don't ever do that, right? So you need to uphold research integrity, avoid plagiarism. AI assists you as the author. You need to maintain transparency, disclose all AI using your methodology session, because when you look at some of these research papers, there are areas where you're being asked to tell us if you use AI in executing this research. And in that case, of course, you say, oh, I use AI in cleaning it up. Because if you use something like Grammarly in correcting your spellings, that is an AI tool. So you need to note it that Grammarly was used as an AI tool to cross-check, change the spelling and all of that. So that's fine. So you must make sure you maintain transparency in your reporting. Don't upload patients' data, upload research with what? Integrity. So I think this is definitely the last slide, and which I'm going to take some of your questions. And also, just like I talked about the prompt book, that's really very outstanding one for you. You wouldn't want to miss out on that. And so the way forward now is, if I'm trying to prepare the next generation of physician researchers now, we must make sure we incorporate AI into the curriculum. And this is actually a very beautiful job that is being done by this particular group, bringing opportunities to talk about how AI contributes in medical research and lining up very worthy and credible speakers to come and address this at this present time. I must really say I'm really very I must applaud the organizers of this, because this is coming at the right time. So I'm going to say this, that these tools are quite very important, and understanding the fundamentals will build that literacy, because we need AI literacy training in our schools on data science and all of that. And also, you see evidence synthesis like systematic reviews, meta-analysis, we must understand as medical researchers that when it comes to there's something we call the hierarchy and Beck evidence. I'm going to show you that now in a second. Now, let me just kind of hit the internet. Now, if you're watching this now, I'm just going to open the internet now. And I'm going to search. Okay, I'm just going to shift this now. Now, let's search. There's something called the hierarchy. The hierarchy of evidence in research by Pollitt and Beck. It was by Pollitt and Beck. I'm going to remember this. Now, if I cannot hit this on the research now, and I go to this part, now let me show you guys something now. I'm going to just show you something quickly now. Now, if you take a look at this now, let me just kind of zoom in. Now you're going to see, let me use this what happened. I think that's kind of went off. I would call it Pollitt and Beck evidence. So this is the last thing I'm going to be showing you guys now. And let's see, hierarchy. I'm going to search that. Okay, so let me hold it now so that it doesn't go out. So there are so many flow charts out there. So let me just kind of zoom inside this. Let me just zoom inside this. Okay, so I'm just going to let that download. Now, if you look at this now, here, if you can look at my screen now, let me zoom in a bit. Okay, now, all right, so I'm sure you guys can see my screen now. Now, this is what we call the hierarchy of evidence in research. Whenever we talk about hierarchy of evidence, we're talking about what are the type of studies that you publish that has the highest level of evidence. Now, at the base of this pyramid, you have the expert opinion. This is what your doctor said. This is where you look at the editorials and all of that, right? Then on top of this now, you have what we call the case series and case reports. On top of that, you have the case control studies. Here, you can also have cross-sectional studies and a lot of them. Now, if I go on top of this now, I begin to have what we call before to after studies. If you're someone that's familiar with research, there are some what we call before to after studies, okay? Now, this is a cohort study. It could be prospective, it could be retrospective. Now, on top of this, I will have what we call the randomized control trials. So what it means is that as I am going up, look at this one here. Now, you see that as I am going up, it is stronger. Now, why am I showing you this picture? The reason why I'm showing you this image now is because systematic reviews and meta-analysis are at the top. So it means that if you're publishing a systematic review today, right, as a medical researcher, you are really contributing significantly to evidence-based research. You are really a very massive contributor when it comes to what? Evidence-based research. In short, most of the decisions that's been made by World Health Organization, clinical bodies, are based on findings from a systematic review and meta-analysis. So that is where systematic reviews are the base. They try to go down, pick findings from the bottom, and then summarize their evidence. So what are we trying to say? As a researcher who is here, you need to learn how to publish what? As a medical researcher, you can also always apply artificial intelligence to what? Evidence synthesis. So anytime we talk about evidence synthesis, desk-based reviews, scoping reviews, systematic reviews and meta-analysis, because they are guided by what? Very strong clinical practice. All right? So collaboration is also important. You need to also understand how to collaborate in terms of using AI. So all these things is going to happen when we get so massive insights on AI literacy. So in terms of evidence synthesis, like I said, I have already kind of set out a book, slash systematic review prompt book. So you could just go sentinel.com/resources. And once you go there, right, you'll be able to get this systematic review prompt book. You're going to get this particular prompt book. Like, it's really going to be very massive and very helpful for you, guiding you on how to perform proper research in systematic review using the traditional and also the the manual approach. So these are some of what we need to be doing right now. So I want to say a very big thank you. Like I said, you could go to sensei.com/resources. You automatically get that because I can't leave you guys without these helpful resources. Okay. And I think that is going to be that. Kind of spent 40 minutes now. So I would want to take some questions. If there are questions for me, then before we wrap it up. Thank you.
Thank you so much, sir, for this very insightful session. I'm sure most of us here have learned a lot. So we'll be taking questions for the next 10 minutes. If you have any questions, please just put it on the chat box. I'll be sending the attendance sometime this evening, so please fill it once I've sent it. So one of the earlier first questions was how can someone get opportunities for knowledge and certifications in AI? How important is AI in research certifications in getting jobs both nationally and internationally? How can we get access to these job offers?
Okay, all right. So thank you very much for that question. Now, one of the things I usually tell people is that as a researcher, as a medical researcher, you need to, instead of looking for opportunities, you need to make yourself predisposed to getting opportunities. Now, I'm going to say something. I'm going to give you an example. If I didn't show up, or if I wasn't showing up, maybe probably online, I'm not sure I would have been invited for this session because I did not know who, I don't think the person that invited me knew me before now, right? So you need to use platforms like LinkedIn. Like there are so many courses that are being posted out there, and then you need to consistently show up, express your interest. When you express your interest, just like I talked about collaboration here, that's going to give you the opportunity to network with people that will really be very useful in your career. But then it is very important to show up because when you show up, it gives you much more chances for you to have the opportunity to talk to the right people and have them, have very meaningful conversations with them and all of that. Like just essentially just need to show up, and that gives you the opportunity. That's one of the things I do tell people. Then other things that there are Google courses that are being posted out there, on AI, but YouTube is also very helpful. I feel like you need to kind of focus more on you need to focus more on giving value when showing up, and always make sure that you talk about your interests online, because most of us here as medical students, we're always focused on clinical practice and all of that. We don't try to share some of the insights that we do get to the population or to people out there. So what you need to do now is to do what? Show up, look for check out LinkedIn. There are so many repositories out there on LinkedIn that is going to give you some massive access, right? So when you show up there, look at some of those opportunities. Of course, you need to take them once, and then once opportunities comes for collaboration, you jump into it. So that's a very massive platform that gives you access to a lot of things that you really do need. So thank you very much for that. I don't know if I answered that question.
Yes, you've answered it. Thank you, sir.
Okay, so is there another question?
If someone asks, where will you place Notebook LM?
Where what?
Where will you place Notebook LM as one of the AI tools? Where does it fall under?
Where do we place what?
Notebook LM.
I can't even understand it. I'm not really hearing it. Where did we place Notebook?
The person asks, where will you place Notebook LM? It is one of the AI tools. Like,
Okay. Oh. Notebook LM. Okay, Notebook LM. Well, the thing is, it's not really, I won't really it's not about where you place it though, but I feel like it is more about how it helps you, right? So you can, depending on what service the tool offers, if it gives you access to maybe recording your maybe sometimes, maybe let's say for example you're using it to record the reasons, maybe in terms of some of the research activities that you're performing, that's fine. Maybe it could serve as maybe an aid to your research activity, right? Maybe if it helps you in generating, maybe you prompt it and then it gives you access to generate write-ups. Of course, maybe you could praise it in terms of writing. It's just a matter of, it's not about the two. All LLMs are using, most of them are using the same open source. It's about how you judge the findings that it gives you. So we shouldn't just be about, oh, what this one does. There are some AI tools that maybe probably one AI tool can really do so many massive things for you, right? But you need to really understand where the tool, how the tool helps you, particularly in terms of your research. So what does it help you to do? What is it helping you to do? Is it helping you in terms of writing? Is it helping you in terms of maybe cross-checking your work? Is it helping you in terms of recording your reasons? That's fine. You can place it anywhere. But what you need to know is that any output it gives you, you make very sound judgment of it. Thank you. What's the next question?
Okay,
Right.
someone that is interested in pursuing public health is asking for how to strengthen their CV and gain relevant experience. And the person is wondering any opportunities like this one that could help them grow in this field, such as volunteer positions, research opportunities, other online workshops, conferences, certifications, or materials that you can recommend for someone just completely starting out.
Okay, yeah, that's fine. That's great. So as founder of Centicini team, we recently ended our I don't know who is making noise. Somebody's making noise.
Sorry, sir. Please, can you unmute yourself? I have to mute everyone, please.
Okay, you're muted.
Okay. Can you guys hear me now?
Yes, sir. We can hear you loud and clear, sir.
Okay, all right, okay, thank you. So yes, you asked about where to get opportunities. Of course, you can always volunteer for internships, right? So like I said, we just concluded at Centicini, as founder of Centicini, we recently concluded a systematic review internship. It was a 1 month internship and then down to your publication. So I believe if you're looking for some of those opportunities, maybe in next batch, you can always check out. And then also look out for opportunities on LinkedIn. There are lots of workshops out there. Join teams, volunteer for teams. Of course, we're always very much open. We have our physical hubs where we help, where we train, we provide our workbook. We have our workbook recently that we published for interns. And that's one of the materials I will really, really recommend for anybody. And sure, I'm going to share the material. It's online. You could just search Centicini Academy. There is a workbook that guides you. It's a 6 months workbook that guides you on how to do research for 6 months with expected outcomes in each month. So it's not like you're wandering online looking for how to patch yourself in. So all you can just do is just search Centicini Academy, right? You could just search Centicini Academy online and then you can get the workbook. Of course, I'm sure it's really going to be very helpful. This residency workbook, yeah, it's one that is going to be really very helpful, particularly for anybody who is trying to get in touch with, don't mind this pricing here. I think that is in Kenya, but you can always just change it to NGN, and then of course that's going to work. So you can go online. There are hard copies available, very voluminous and helpful for your research collaboration. And also, apart from these two, you can also go online. You can go online, go to LinkedIn, show up, look for collaboration, join teams. If you're interested, you can always reach out. The medical, we can always collaborate. So just be open to give value. That's one of the things people don't understand. Let me tell you something. As much as people would want to, you want to join so many groups and all that, always be willing to provide value. Put value first before any other thing. So always make sure you put what? You put value first and get the right materials. Follow the right people on LinkedIn, on some of those platforms. Because when you get to some of the social media platforms, you don't just come there, look for the people that align with your interests. You follow them, you ask them questions, and then you do the right thing. Then if you're not able to maybe join some platforms, you can get this workbook. You sit at home, you follow it line by line. Expected learning outcomes each for 6 months. You should be able to drive you into having that capacity to do what? To gain publications. Because the most important thing there is that at the end of your research, you should be able to say, okay, this is the insights I have uncovered while doing so and so research. So these things are really very important and helpful for you in your journey. So make sure you also reach out to organizers, you collaborate, you volunteer. That way, you will get more information about where to go. Because one of your strengths in public health, let me tell you guys something. If you're somebody that is in public health, maybe really, and it's just more public health than you are, you need to be really hardworking because the competition is much. So you need to really develop yourself. If you're transitioning to public health, maybe from medicine, of course, maybe it might be fair, but if your background is public health, you need to be really hard on yourself. You need to develop yourself. The numbers are important. What I mean by the numbers now, I'm talking about the publication count, the impact, volunteering experience, internship opportunities. These things really help. They go a long way in helping and shaping your career. So, of course, if there are openings of maybe our next systematic review internship, which is free, would always announce online, and then of course, if there's anything, we'll definitely let you guys know. So I think that is that for that question.
Thank you very much, sir. Thank you very much, sir, for all the questions, sir. So a lot of people have been reaching out to me personally regarding the points which you mentioned and some your LinkedIn profile. So please, I really appreciate it. Maybe if after the webinar, you can just maybe send your LinkedIn profile and any details about the prompt book to me, so I can forward it to all the participants as requested, sir. So yes, sir. So in use of time, like I would just like to skip some questions briefly, because some questions are actually meant for some other speakers, like one worrying about like the ethics with whether they are some ethics regarding research. So but for the few questions, like I would just like you to actually just go through briefly is the question on, like, someone asked about like they are building an operating system for clinic and hospital, and their long-term vision is to use patient data and of course with their consent to build a synthetic data that studies how these patients respond to treatment of disease, and their organization like are looking to leverage this data for their program intervention. So they are asking you about this. I think this systemic data is for the second speaker, but you can just maybe give some light on it, like on concerning the synthetic data, like what are your concerns when it comes to the authenticity, and also like what tools do you think fit into this their work properly? I don't know if maybe if I was far, you can just go to the chat section. I think the question is there. Briefly, you can just go through it.
Okay, all right. So I'm just gonna try and open the chat now. So, if I really heard what you said, you talked about you talked about maybe trying to use maybe any kind of AI tools that helps in doing some form of data analysis, right? Because basically all this is working on data, is data analysis, how to extract insights from exactly. That. Of course, one of it, like I said, like I did mention, the best thing you can do for yourself is to, okay, I'm reading as we operating system for clinical. We hold on a minute, please. We are building outcomes. And big. Okay, well, the thing is, one of the things we need to understand is that, just like you said, there are actually some, I've read this question, so there are some tools that are really very much important, particularly, let's say, if you're somebody that knows how to integrate cloud code, Claude, that's Claude now, I'm talking of Cloud now, by Anthropic, with your Python environment, right? As somebody that as a machine learning engineer, I think I've kind of released some videos, although I haven't really released any video on the detailed process of how to integrate that, but I've kind of done some overview and all of that. That is really going to be a very helpful one. But then, in terms of concerns when it comes to densities and all of that, like I said, so many of these LLMs, we are talking of accuracy score. If you're someone that is really familiar with machine learning, you'll talk about accuracy score. Some of them are, 90% accurate. There are still room for hallucinations, So as much as you're using these tools, you're integrating these tools into your workflow, there are still tendencies for some kind of ROC, right? More like, let me use this one. Let me not say ROC. Let me say the confidence interval. It's not really. It's you're not going to say 100%, right? Maybe go 95%. So, but there are some that are quite really very good. Like Cloud Code performs so well. So better integration. Then you use Python to run some of those scripts. It's going to make a lot of sense. But anything that deals with synthetic data, maybe this person can reach out to me, and I will still show you personally some things that you need to understand. So I don't kind of use so many advanced terms, right? So, but yes. So, but the point I'm trying to buttress here now is that as much as we are guiding these tools, we are using automating with these tools. Just understand that we still need to make sure that we don't just leave everything for the tools. We also check for the accuracy. I would still want to show you one or two things, you understand, particularly with respect to some of these projects that I'm talking about, probably when you reach out. So, but I think at that, if there's any other question, so that I would.
Thank you very much, sir, for your response. I think the person that asked, John Mobelaji, I believe you're on the WhatsApp group. Please just reach out to me later. I'll share your contact with him here, and probably you guys can discuss more about it. So thank you very much, sir.
Yes. So, yes. All right. Okay. Okay. Thank you so much, guys, for your time. So, I want to really, the last thing I'm going to say is, I want to really encourage you guys. What the most important thing you need to do is I must really appreciate the organizers. They did a very great job. And basically most of what people need to know is that you need to always start on time, right? Make sure you start on time. Don't look at your friends when it comes to things that pertains with your future, right? Don't look at your friends. Always make sure that you do what? You take the bull by the horn. The one I want to tell medical students, can you guys hear me? Medical students, can you hear me? Medical students.
Yeah, we can
Please,
hear
Yes, we can
you.
hear you, sir.
Make sure you scale up. Make sure you scale up. It's very, very important. Make sure you scale up. Show up on LinkedIn. Show up on the right platforms. Don't spend your time on things that doesn't really make any sense, right? Spend time on things that will add value to your life. And trust me, you're definitely going to be a success. I want to say a very big thank you to the organizers for their time. And other than that, thank you very much for your time. And bye-bye.
Sorry, sir. Please, just a kind request, sir. Sir, before you go, maybe while the second speaker is still speaking, there are still some questions like for you in the chat box. Please, can you just address them before you go, sir? In the chat box,
I will chat on the. I'll write on the chat bot now. Okay, I'll write on the chat bot. Okay.
Thank you very much,
Thank
sir.
you, sir. Okay, thank
Thank
you,
you
sir.
so much.
Our next speaker is Dr. Abimbola Olaniran. He's a global health physician and health system specialist with 20 years of experience, focused on low resource settings across Africa. He holds an MBBS from University of Ibadan, a PhD in tropical medicine from Liverpool, and an executive MBA. And he's currently completing an AI for business diploma at Oxford. He has worked with the WHO, Gates Foundation, and the Global Fund, and is NBIDIA certified in generative AI. Today, he'll be speaking on the ethical considerations and limitations of AI in medicine. And we'll also take questions after this session.
Thank you very much. It's really good to be here, and I am really appreciative of the opportunity. Um, I think in the interest of the environment we find ourselves, in which the internet sometimes is not predictable, I think Amir is the one I know in this space. So in case my internet goes off, please just send me a WhatsApp chat to let me know that people can hear me anymore. Yeah,
All right, sir.
please. Yes, please
All
do
right, sir.
that
I'll
for
do
me.
that, sir. Yes.
Okay, so I will share my screen now. But before I share my screen, it's good to know everybody in the room. I think first of all, one thing I would like you to do for me is to tell me which AI tools you use. And for example, if you use Claude, what model do you use? And if you use ChatGPT, which of the models you use? I want to just have a feel of to what extent are we familiar with some of these tools. Please, let's use the chat. Let the chat get busy. I think it's Ifeoluwa or is it Rukaya that's helping us to, moderate?
No, is Uzoma Kwesochukwu.
Okay, Uzoma. Uzoma, please could you help me with the chat? I think I'm not sure if I can still see my page. Sorry, if I can still see the chat. So what are people saying in terms of the kind of tool they use and in terms of which of the models? If you could help me read it out, I would deeply appreciate that. Uzoma, could you help me with that, please? Then let me turn off my camera just to save.
Yes.
Okay, please go ahead.
People are using Notebook LM, Orion,
Okay.
DeepSeek, Canva. Then please, everybody, please put the model you use. If nobody has really put the model, but they're using Boreum, DeepSeek, Canva, Notepad, Gemini, ChatGPT.
Okay, but without putting the model. Okay, I think with the permission of Amil and Uzoma, I want to raise everybody's adrenaline a little bit. Yeah, people, there's this concern that AI is coming to take your job. And the truth about it is that AI is not coming to take your job, but someone who uses AI is likely to take your job. And, it's of major concern. And so it's good that you're actually attending this webinar so that you can begin to embed yourself within that AI space and hoping that you will get yourself skilled before the AI really takes over. I do attend, there's this like a ground round by Stanford every Thursday, which I get to attend because I belong to a group. And one thing that I can see there is that they're really doing a lot in terms of diagnosis, in terms of, even escalating situation with AI. So the radiology diagnosis is just one human, one expert that, and many agents. I don't know whether we're very conversant with AI agents. What do we know about AI agents? Please let's use the chat also. What do we think AI? Because I'll be talking a little bit about it. Please let's use the chat. Uzoma, if you can help me read out what people are saying about AI agents, I think that would also be helpful. I'll be talking a bit about it later on. Uzoma, over to you.
So far, no one has said anything about AI agents. Some said they have no idea.
Oh, no idea about AI agents. Okay. So I don't know whether any of us has actually looked for accommodation in any place, any part of Nigeria, but I live in Lagos, so maybe I'll speak for Lagos. So when you're looking for accommodation, there are agents accommodation agents that you tend to work with. And when you meet them, they will show you the accommodation. They will act on behalf of the landlord. Sorry, can someone please go on mute? I think I'm hearing feedback sound. So they will act on behalf of the landlord. So in this situation where you have agents are now beginning to take autonomous decision. So for example, the AI agent will receive the lab result and send the diagnosis to the patient and can now even prescribe. That is the phase we're moving to. And now there's that concern that is it really, really safe for us to move into that space where AI is beginning to act autonomously? The CEO of Claude, that's Dario, he expressed such concern that AI needs to be really, really regulated. And that's one of the things that I'm going to be talking about. But there's also the flip side of the coin that if you over-regulate, then you kill innovation. I'm sure that debate can go on till tomorrow. Should we regulate? Should we allow innovation? Will regulation actually kill innovation? So those are some of the things I'll be talking about. But for this afternoon, ethical consideration and limitations of AI in medicine. This kind of illustrates some of the learning objectives. I will just skip that. Sorry. Okay, so this is what we're going to be walking through in the next 1 hour. One is the algorithm bias. The other bit is the data privacy. The other bit is the patient-physician trust, the black box, and the practical strategies. Now, one key challenge everyone is facing at the moment is the rate of AI adoption. Now, I'm looking at the hospital-facing side of things. Many thanks to Dr. David, who has really done justice to the research side of things. Now, a lot of AI tools are being approved by the Food and Drug Administration in America. That's like our own NAFDAC that kind of offers approval to different tools. So it is, outpacing the regulatory frameworks. And people are beginning to express concern that in this era of AI agents, in which AI is actually getting some autonomy to be able to, make decisions on behalf of the LLM and, contact the patient and things like that, even though, there are cautions within the medical space, but in other spaces, AI agents can actually do your shopping for you because it's believed that AI actually understands you better than your parents and better than your best friend. Because over time, when you've been interacting, pressing things pressing a lot of prompts, over time, AI tends to understand you because that's the way the algorithms are actually built. So now if they're going to make decisions on behalf of patients, on behalf of doctors, there's a big need for regulation. But what does AI actually promise us? And this is particularly important in Nigeria, because one thing that we continue to contend with is that we don't even have enough doctors, we don't have enough nurses. So can AI actually help us to address some of these challenges that we're facing within Nigeria? So they can actually help with sharper diagnosis. So like the meeting I used to attend, with the Stanford group, they've done extensive research in comparing, diagnosis made by junior doctors, that have read maybe the ECG, or even have read, X-rays. I've also looked at maybe pathology slides, and they found that for the junior doctors, maybe first-year resident, second-year resident, AI was actually better. But when it comes to the senior doctors, they found out that sorry, is someone singing? So when it comes to the senior doctors, they found out that they were actually better. So the question is, the salaries of junior doctors is enormous. Should we hire AI agents that will read the X-rays, that will read the the slides, or that will read the ECG and provide a tentative diagnosis for the patient, and a senior doctor will just come in and just review. So with that, also there, you make decisions faster. So one of the last meetings I attended with the Stanford group is that they created, an AI tool in which, when they drop the blood of the patient that has come with fever, the drop of blood will kind of, it's processed, and it will read it to tell whether it's a viral infection, whether it's a bacterial infection, and make, some form of diagnosis, so that if an intervention is needed immediately, that can, they can proceed with that, because with the other clinical judgment of the doctor, they can at least start the treatment rather than waiting for the lab to release the result. The other bit is the wider reach. So with AI, doctors in UK, doctors in America can now begin to also participate in the diagnosis of patients. So many, it's not very prominent in Africa or in Nigeria, but many people are beginning to consider, the telemedicine side of things, which AI actually offers us. You have a patient in my own remote village. There's a community health worker with that patient. She's taking the history. AI can actually summarize and synthesize the history and the examination to something that a doctor who is well trained in the UK can begin to provide his inputs, begin to provide his own input, and based on that, a community health worker might be able to provide a prescription which they might find in the nearest chemist, rather than the patient having to travel 2 hours to the nearest hospital. The other bit of it is also the lighter workload. So there are AI agents right now that, one of the things that doctors are beginning to struggle with, particularly in places where they're introducing electronic medical records, it's the bit of documentation. Now they need to type in, and that really takes their time. But with AI, where voice prompts and everything, it can, and if you some there are AI note takers. So with AI note takers, it's just you have a seamless discussion with your patient, and the AI identifies the patient, it identifies the doctor, and it takes that note and it synthesizes it to something that's clinically meaningful, and that takes off the workload from the doctor. So AI actually promises a lot of things, but we still need to exercise caution, particularly in this environment. Now, what are the fault lines that we need to watch out for? And Uzoma, I'll be relying on you to know, to get an idea of what my audience actually knows about algorithms.
Okay, sir.
Yeah, please, let's use the chat box, the chat box. Uzoma, as soon as they drop their opinion or perceptions within the chat box, sorry, I'm saying chat bot a lot. Chat box, please read it out.
Okay. Please, let's use the chat box and not the real-time text.
Yeah, because it's important that we actually understand the things I'm discussing, and I'm not speaking concepts that we really don't understand.
If someone said practically a set of steps, flows, or logic to solve a problem.
Fantastic. So I really don't need to go further. So algorithms are things that we use in clinical practice. A patient comes to the A&E, that we talk about ABC. Is the patient is the airway patent? If the air is patent, then move to B, which is breathing. If breathing is okay, then move to circulation. That's an algorithm by itself, because it tells the steps that you're actually supposed to take. So the algorithm bias in this case, there are also a lot of algorithms within AI, within the AI space. So within that AI space, models actually contain some algorithms, and that is what makes them function. Now, imagine a model that was actually trained on narrow data. So I'll give this example just to illustrate it, and I'll try to manage time. So, for example, I served in one of the states up north many years ago, in which I had some doctors from another country in Southeast Asia. I won't want to mention the name of the country in case some of us are from there, and I really love the people there. So, but when it comes to obstetrics and gynecology patients, you would not see. So one day I confronted him because he was collecting almost 10% of my own salary as a copper. So I confronted him that why are you not seeing obstetrics and gynecology? He said they were not trained in the country where he's from, that they don't see obstetrics and gynecology patients, that it's another group. So if you translate that into AI, imagine a model that was trained on data from US, data from UK with white-skinned people. When you apply to Nigeria, maybe in a dermatology clinic, it will not be the fault of the model if it misses out certain things, because the training data did not include that. And I have a practical example drawing on my own experience. So at the time that ATM used to work in Nigeria, anytime I want to go and withdraw money, some of you might have seen my face that I'm really dark skinned. Anytime I want to go and withdraw money, I cannot afford to wear a black shirt. Because if I wear a black shirt, the ATM machine will tell me that no face recognized, meaning that the algorithm behind that ATM machine that recognizes face and decides to process your facial data before releasing money to you was not trained on my own type of skin. So when we bring models from different parts of the world and expect it to work automatically within our setting, then it brings a little bit of problem. So those are some of the things we need to consider. Then there's also the data privacy and data security. When it comes to, there are two particular domains in which data is really, really sensitive: healthcare and financial. So the banking industry and healthcare, the data there is very, very sensitive. And it has to be based on tight control. We'll talk about that a little bit more. There's also the patient-physician relationship, in which trust, empathy, and judgment cannot be automated. Now, AI tries to automate trust, empathy, and judgment, but we'll discuss that a little bit more. When you hear AI actually interacting with you like he's real human, you even say, "Oh no, oh sorry about that." I've attended some interviews, like job interviews, that was actually AI, AI coordinated. It was an AI agent speaking to me and conducted the interview. To be honest, I found them more useful than some human interviews I've attended. So that's place of AI actually taking trust and empathy and judgment. It's also something we need to watch out for, which we'll be talking about later. Now, there's a black box. The black box, let me try and explain what the black box actually means. Anything that you give an input to and provides you an output, and you are not very clear about how he provided that output to you, is more like a black box. You've given it a question, it's thrown an answer at you. It might be correct, it might not be correct, but you're asking that, okay, how did you get to that answer? Then that's the black box, and which we are going to talk about sometimes later. Now, there are various organizations that have actually been working on, principles of ethical AI. First principle is that you need to protect autonomy. Like when I say that AI agents can actually act autonomously, it shouldn't be in healthcare. It shouldn't be in healthcare. The AI agent will receive a lab result, read the lab result, make a diagnosis based on the synthesized clinical notes, and begin to write prescription. Should that be in healthcare? I really don't think so, because you can't replace the human effort here. Then you should also promote the well-being and safety of patients. AI must never do harm, and it must also meet safety, accuracy, and efficacy standard. There's also the transparency and explainability. Now, one of the key key objectives of this session is to be able to talk about explainable AI. With AI, there's also the input, there's the hidden layer. Hidden layer is where all the algorithms are being processed. And it just turns out an output. You go to your ChatGPT, you go to your Gemini, you put in your prompts, and the next thing it throws out an answer. People now want to know why it decided on this and not that. And for more recent models, that explainability is now becoming more important, and it cannot be more important in any other sector, like a sector like healthcare. If AI should say that this patient is likely to have this disease and everything, how did you get at that answer? It's becoming more important in healthcare. More important generally, but it's very, very important in healthcare. Responsibility and accountability. Clear human answerability for AI influence outcome. Machines should not be liable. That's what some people say. But I'm going to be asking us a question. Maybe I can ask now, which I would want our response. Now, if AI makes a wrong diagnosis, for example, a biopsy has taken, maybe some slides have been smeared, and AI makes a wrong diagnosis, particularly when it comes to cancer or no cancer, and overall the patient is mismanaged. Who should be held accountable? That's one question we should keep in our left hand, because I'll be coming back to it. Now, there's also the issue about inclusiveness and equity. Now, the people in the remote regions who are still struggling with electricity, struggling with different things, and can you begin to discuss AI? Can you begin to discuss how AI could also enhance their treatment? And if you don't apply AI to take their data, the AI tools you are using does not reflect. It's just like that my colleague that said he wasn't trained in obstetrics and gynecology, so he can't answer questions. I mean, he can't manage patients with obstetrics and gynecology patients. If AI does not take in their data, the question is, should we use AI tool to address their problem when it wasn't trained on their data? So there's the inclusiveness and equity that AI should be designed for all, and we should consider data across population. Now, I know there was the question about synthetic data. So I'm sure we're still going to come back to that in the question and answer. But as a quick response, synthetic data sometimes can be useful in populations that are underrepresented, where the data there it's not adequate, and you're trying to use some AI large language models to be able to manipulate the available data to create different scenarios for to have more data. So some of the data will be synthetic. So for example, if it's like the picture of a man standing upright, you could alter it a little bit. What will it look like if he's not standing upright? If he has a mark on his face, if he has a mark on the hand and things like that, you alter the data significantly so that you have much more data, because that population is underrepresented. And based on that, you now train your model based on the available and the synthesized data. So, that's one way in which people have tried to address the problem with scarcity of data, in which just to ensure that no one is actually left behind. So it's also about being responsive and sustainable in general. Now, going to the first one, which the first objective, I've talked about the algorithm bias and healthy equity, in which if the data is actually skewed in training, the training data, like data set over represent the wealthy, light-skinned Western patients, like something I've faced before when I talked about not being able to use ATM machine any day I'm wearing a black shirt. When models, they will learn the skew, so the models will tend to be biased. So it depends on what you were trained on. So even in medical school, if you aren't trained on certain things, that's why they train us in tropical medicine. So you'll be able to see the malaria and some other things. Things like Crohn's disease, if you aren't trained on it, if they tell you to come and manage it, I'm not sure you will probably do the best. I've also seen people abroad that when they tell them to come and manage malaria, then there'll be calamity because they weren't trained on it. So if the model wasn't trained on that, then the prediction will miss disease pattern in particularly underserved and the unrepresented population. The question is, how do we deal with that problem? Because AI models now, they're not really prioritizing, Nigeria, Africa, and things like that. And the African genome and skin tones are scarce in most data sets. Early this morning, I was going through Claude, the Opus 4.8, and was trying to look at the model card. Fortunately, they considered Hausa, Igbo, and Yoruba in the minority data set and everything, not the medical one. I mean, I couldn't go to the model card. I'll talk about the model card very soon. So, but what do we do? And that responsibility is on us. We cannot begin to blame, the United States, United Kingdom, that they are not really considering Nigeria, they're not considering us. What are we doing to ensure that the models we're going to be using in the nearest future actually consider the local people here so that it's appropriate? They're not managing, they're not managing diseases they've never seen before, or they're not managing skin tones or genomes that they've never experienced. So accuracy sometimes also depend. I think I've flogged this point a little bit. A model will excel on the data is trained on, and quietly fail the patient. It rarely saw. Few data sets. I think I've flogged this quite enough. So I will not dwell on that any longer. Now, the question is, who actually owns the key? This is now talking about data privacy and security for patient health information. One thing about patient-doctor relationship is that they trust us. Now, if you now breach that trust, it becomes a really big problem. And the question is, how do we ensure that we do not breach this trust when it comes to, use of AI? Like I said, AI has come to stay. That's my own belief. Now, when you have patients that you're using their data, and we say we've anonymized their scans so that it cannot be linked to them anymore. Now, I really struggle and quarrel with this anonymization because some data can actually be de-anonymized. So, for example, if you're my very, very close friend, and I see you in the news, but because they've put something across your face, but you're still wearing that designer shirt that I know you with, you still have that skin tone, you still have that voice, which they've managed to mask a bit, I will say, oh, this is this person because I know this person well. There are certain things that it might be difficult. So when you sign consent with your patient and everything, what steps are you actually putting in place to ensure that this patient, there's no re-identification? If there's a breach exposure, this now has to do with cybersecurity. One leaked database can expose millions of records. One of the medical bodies many years ago, I would not mention name, there was a time, I don't know whether it was a cyber attack, but all our registration numbers and everything got leaked, including the password. You know, many people actually use password, one single password for everything. So even when they called on people to come and register the next year, the people were a little bit reluctant. So privacy is actually everyone's duty within, within the medical space. So it's not just about signing the consent form. The question is, what are you putting in place to ensure that that consent is not breached? Then there's also the cross-border flow of information. And I will share why it's of major concern. I don't know how many of us are familiar with the National Data Protection Act that was enacted in 2023. It talks about data sovereignty. Data sovereignty means that some of the most sensitive data, particularly in healthcare and also within the financial industry, must never be allowed to leave Nigeria. But the data centers where this information are being processed, for example, ChatGPT, when you type into ChatGPT, it goes into the cloud, but it's probably going into maybe United States, UK, to process before giving you that inference, before giving you that insight using the internet. So, like Dr. David mentioned, never put your patient's name or identifier within that. And in Nigeria, they have actually said that no data, particularly healthcare, there's a way in which they rank it, should leave the shores of Nigeria. Nigeria is still lucky. We have some data centers, whether they're the most appropriate for healthcare, it's a question for another day. Now, there's also the blurred consent. Patient rarely knows that their data is training commercial model. So when you take that consent from the patient, these are things that will be relevant in the nearest future. Like I said, people that have AI knowledge, whether it's governance, whether it's practice, will definitely take the jobs of other people. I mean, it's almost like a stark, naked truth that must be told to everyone, including healthcare. So when we take a blood consent, the patients, there's a place where, we go for outside posting when I was a medical student. What the people will usually tell you is that, doctor, you know best. Any decision you take, I'm fine with it. So when you ask the patient would not even, object. But these things can become, sources of litigation in the future. So when we take a consent, we should be careful that you also take consent if you're going to use their data to actually train commercial models. So data is something that people sell. So you've compiled the case note of 2,000 or 2 million patients across Nigeria, and you've compiled the characteristics of their data, of their demographics and clinical condition and things like that. And you're going to use it to train a model that they want to deploy in Nigeria to be able to make diagnosis and things like that. The company that wants to come and deploy in Nigeria will definitely pay you some money. But the question is, did you tell the patient? And if you told the patient, what are you giving them back? One thing I like Google for, I'm not promoting Google, is that they usually give back. Because when you type into Google, many people will feel, oh, Google is free. But to be honest, what I tell people, I'm not telling us in this class, but what I tell people is that you are the one that is free. Because each time you type, they're taking your information, they're using it to generate advertisement, they're using it to create different products, they're using it to sell and market and things like that. And that's where they make their money from. But they do give back. But that's not a discussion for today. So when you take your patient's data to train commercial model, are you going to give back and are you going to let them know? So one thing that the National Data Protection Act of 2023 actually says is that if there has been a breach from your own end, you must report it within 72 hours. So for those that are going to be deploying, models, they're going to be operating with patient data and things like that. There's that act. Maybe I will encourage us to read the act if we are dealing with data. Now, this is just a summary of the comparing Nigeria with EU and America. The Nigerian, Data Protection Act started in 2023, whereas the EU Act has been around 2018 to 2024. There's a replica in America which has been around since 1996. So, these things are in place. And if you're dealing with data, I think it's important that we actually go through it in some detail. Now, what's the Nigeria Data Protection Act demands of the patient? The patient has rights. They have rights to access their data. You've collected information, it's in their case notes. They have rights to it. And they can withdraw consent at any time. Whether you've sent their data for training a model, they can withdraw that consent. And they might decide that, they want their data and things like that. And if you contravene, then they can report, they can lodge a complaint. So what are our own duties on the side of the providers? First of all, the question is, why are you collecting this data? Is it necessary? Does it infringe on the rights of the patient? Does it protect the patient, or does it do any good? There's the Helsinki Declaration. First of all, do no harm. Then there must be a data protection officer that recognized and has been trained. So, for example, the NDPA, there's a portal in which everyone that deals with data, particularly you're supposed to undergo a form of training. I've done that training, and you're supposed to submit the certification. So if there's going to be a cross-border transfer, you have to document the safeguard. So, for example, if you're going to be sharing the data anonymized using one of these models, one of these LLMs, it has already crossed the border. That needs to be documented and shared with the NDPC. That's the commission, and get their permission before that is actually done. The penalties is actually 10 million naira, or I think 2% of the revenue being made by the company. So these are things we need to consider in this AI era. And when you have this information, you are better positioned to be able to take on jobs that require management of AI tools within the clinical setting or even within research setting. Now, the bit I cannot overemphasize is the human in the loop. Now, that's the technical way of referring to it, that humans have, you cannot kick out humans entirely when it comes to AI. Now, some people will also call it human AI, human algorithm interaction, in which humans have to make the final decision. So that way of thinking will be important in answering my question about when AI makes a mistake in the diagnosis, who should be held responsible. Now, what the algorithm cannot replace, but is already trying to replace, is that the empathy and the human bond. Now, for some automation tools that actually do a personalization, they will call you by your first name. They will sometimes they might even speak your local language, and they would retain your information so that they're having a meaningful discussion. That last week we noticed that your blood sugar was 140 milligrams per deciliter, and we're really concerned. We think you should, that's like a normal conversation you have with your doctor or with your nurse or with the healthcare professional. But the moral judgment and consent, these are automated tools. You will really think they care, but they're just operating based on the algorithm they've been programmed with. So I talked extensively about some of the things they do, so I will not go into that. So the goal is that AI should augment, not substitution. So AI makes you to see more patients. AI makes you to get diagnosis faster, whether it's laboratory, whether it's clinical, but it should never substitute the role of a doctor, the role of a nurse, the role of the healthcare professional. That is actually the goal. It's augmentation, not substitution. Now, inside the black box, transparency, accountability, and regulation. Now, we already talked about it, that anything, this is just like an oversimplification of things, that you throw in an input and it provides an output, but you really don't know how it got the output. It's more like a black box. That's like a non-technical way of putting things. You put something in ChatGPT and it spills out an answer that kind of makes sense, whether it's hallucinating, confabulating, or what. It's out of the question for today. Someone once asked me, the person just started using ChatGPT. He asked me that who is actually behind that ChatGPT? That is the person staying awake to answer all these questions. That who is the person? Then I laughed, because the question the person is asking is that, oh, this thing is a black box. What's the explainability? So the two ways to open that opaque model is the model card. The AI tools they are making nowadays, most of them will have a model card. So like I mentioned earlier this morning, I was going through the model card for Claude. That's the Opus 4.8. I think that's their most advanced model before they banned this Fable 5. The model data, I mean the documentation is like 250 pages. And what they're trying to achieve is the explainable AI, to see what data actually went into the training. So if you're going to be using AI for anything, particularly when it comes to healthcare and management of patients, you first of all need to understand what data did they use to train this model, and to what extent can you trust it? So if the model was not trained on, you want to use in a dermatology clinic, it wasn't trained on people that are of Negro race, but more of Caucasians and other races, then you need to be careful. The question is, there's also the fine-tuning of models, which you can do and adjust some of the weights and come and train the model without some of our own local data. The other thing that you'll see within the model card is the benchmarking. So when they do the benchmark, I'm sure many of us are familiar with benchmarks. So benchmarking is you compare that model with other models and how they perform on certain indicators. So for example, in making a clinical diagnosis, how does Gemini compare with Claude, with Perplexity, with ChatGPT? All those scores are over there because some people have actually done the performance assessment. It's just the same way that when you want to get a job, maybe to work in certain hospitals, they will do a test and they will benchmark you with other people that want to take that job. So when you open the model card, you will find that details there. So when you decide to use a particular model, you must be able to justify why you're using it for diagnosis or why you're using it for data synthesis compared to others, or why you're using a particular environment where this language is popular compared to other models that were trained on data with that language. And that begins to unpack things with explainable AI, which shows the feature that drove the case output. So when a model turns out an answer, you could probably say, oh, I can't really trust this model because it wasn't trained with black skin. So therefore, you will still want to have a ground round and hear from others. Whereas if that model, the benchmark was 99% on black skin lesions and things like that, yes, maybe you just need one expert to validate that. So that is where the black box and the explainable AI actually comes in. Now, this is modeled, this is comparing, the hidden layer and the AI models in comparison to the human brain. So we can begin to see the similarities. So above and to the left is the biological neuron. Many of us are kind of familiar with it. This is an oversimplified neuron. That has the dendrite, that has the soma, that has the axon, and it's transmitting information within for deep learning. Now, this is deep learning, not deep learning. We have the artificial perceptron. They call it perceptron. You have the input. Input is also what goes into the dendrites medically. And there's the hidden layer, which kind of where you have all the algorithms before it turns out an output. And the output is what we get. In the human body is also about output. Now, the question is, can we also say the human brain it's a black box? Maybe the neuroscientists will disagree, but the question is, I've asked different questions, and different people have turned out different answers. And to be honest, I can't really say why this person answered this way and why the other person answered that way. So should we we'll still listen to humans. Should we say because human is, the brain is also a black box, that we can't listen to it as much? So the question is, what measures do we put in place? I think this is the part where I would like to ask that question. If AI makes a mistake in the clinical setting, who should we blame? The first is the management of the health facility. The second is maybe the doctor. The third is maybe the developer. It could be OpenAI, it could be Anthropic that makes Claude, it could be Google that makes Gemini. Who should we actually blame? Uzoma, this is where I would need your to voice over some of the responses. But please let the chat box get busy. Who should we blame?
Please, everybody should reply in the chat.
Yeah, as the responses come, Uzoma, please,
Okay,
you can read that.
someone said the doctor, but others are still typing.
Okay. Any other response?
No, but there are still like 3 people are typing.
Okay.
Okay, someone
No.
said
Okay. Read out, please.
it is still legally messy. The AI is not a doctor, but AI companies should have some form of liability for incorrect diagnosis. Mother, please mute your mic.
Okay, any other
Another person
response
said
before we go ahead?
the management, if it was hospital-based. Another person said for accountability, there are several layers, but I think the facility that directly uses the AI should be most liable. If, however, it is a consumer AI, the individual will probably have the highest fault of choice than the developers or institutes behind the AI, especially if transparency or accuracy is not well disclosed. Another person said it should be the developer. Another said, I don't think we can blame one person in particular.
Okay, thank you very much. Uzoma, I think we've all spoken well, and those answers are very, very correct. So the question is, sorry, please, can we mute our mics so
Please,
that
Anna Slawal, please mute your mic.
so when AI errs, who answers? Now the developer. So the developer could be OpenAI, Anthropic, Google. Did the model meet its validation claims? So for example, if they did a benchmark, they've turned out the benchmark, it was trained on 1,004 people, and it was accurate on this. Now, you've come to test the model within that same population. Did it actually meet it? So if the fault was because the maybe Google or Anthropic claimed that 99% within this population, and now you've used it for 100 people and it only met 84%, maybe there should be a claim there. Now, the other bit of it is the hospital. Was it deployed within its approved use? Now, in any hospital that will use AI, there should be a governance body that should be first established. Is the governance body that will review the model card and compare how well this AI is actually doing. and whether we should use it or not. To what extent should AI actually act? Should it just be automation, just reminding people of their clinical appointment, or should it be acting as an agent in which is now making prescription and sending to people? Those, if the hospital faulted in this regard, then they are liable. Now, the other thing is the clinician could also be liable, because one of the concerns with use of AI is that over time, even the clinicians will trust AI better than their judgment. So anything AI says, they just rubber stamp, or AI is always correct. You know, they trained this model based on 1 million people. It can't be wrong. How many patients have I seen in my life? So they just rubber stamp. So if the clinician rubber stamps, then the clinician is liable. Because AI, the way experimenting with AI will seek your permission. So I use Claude Opus 4.8. It will usually seek my permission for any step it's taken. Now, it's also it could also be the regulators, where the right guardrails in place. So, for example, in Nigeria, the regulator is the National Data Protection Commission. Now, they've talked a bit about data protection, but the question is, I think they're still working on the AI governance document. I think it should have been out in March. So for accountability, it's actually shared, but the clinician is who they know. So if anything goes wrong, they'll say it's doctor so and so that made the. So if you're a doctor, if you're a nurse, and you're at the front line, then you need to be more careful. Nobody actually knows the model you use, and they don't know the governance body. So the physician will take the greater, but everybody should be accountable. Now, this is as we begin to round up, this is the EU regulation. I think we will not go so much into it. So one thing that the Anthropic CEO said is that AI actually needs to be regulated, and it shouldn't be voluntary, because he himself was actually getting scared of it. There was a model that Anthropic built not too long ago. I'm talking of 2 weeks or 3 weeks. Fable. Before then, they had built Mythos. Mythos could hack any account as described better than the best hackers. And this tool, if they fall into the wrong hands, they could be devastating. So they built Fable. Then the particular country said that if they were going to give it to anybody, it should only be citizens of their country and not any other person. So they banned it. So the CEO also said that this should be really, really regulated. So from risk to responsible practice, we've considered the algorithm bias, we've considered the data privacy, we've considered the black box, and we've considered the accountability. So 4 things to carry home. Demand fair data. That inclusiveness is very, very important. If you're going to bring in a model from America or from the UK, the question is, have you trained it with data from the remotest part of Rivers State, the remotest part of from Zamfara, the remotest part of Oyo State, before you start using it and you actually work there? You need to also guard their data, treat it with care. You also need to keep humans in the loop. Doctors, nurses should not just rubber stamp what AI has said. Humans should always be in the loop. AI should augment and not take over. Then you need to open the box. If the model card is 251 pages, is 500 pages, someone needs to read it and know what AI can do and what AI should not be doing. I think on this note, I would like to say thank you for listening. Thank you very much. And thanks for the opportunity to make this presentation. I'll stop sharing at this point.
Thank you, sir. This was a very, very rich session. I'm sure everybody here has learned a lot. So I would like that if you have any questions, please just unmute yourself and ask. Please be concise and go straight to the point so that everybody will get the opportunity to ask questions. So please, if you have a question, unmute
Okay,
yourself.
I have a question.
Yes, please go ahead.
I have a question. Please, can you hear me?
Yes, please go ahead.
Okay, I want to talk about because I kind of see AI, like the advent of AI and everything. Like I kind of see it as through the lens of let's say is still at the inception stage. I think there were a lot of things that people said AI would never do. AI would never beat chess grandmasters. AI will never be able to master language. AI will never be able to create art or music. AI will never be able to write professional exams like USMLE or CLAP. And those are things that AI has defeated like in record speed. And then there's this Moore's law and Kurzweil's law of accelerating returns in technology. So I want to actually ask about this area of, let's say, trust and empathy. Are we sure it's just not another, or let's say, another underrating of how far and how well AI can go? Maybe for the rest of the 21st century, who knows whether we can get to a place where AI actually, maybe we get to a place of artificial general intelligence, or to just a height where AI just does things that right now we are saying it cannot do. Let's assume in the next 20 years now, AI now begins to do these things or be able to even match human level of trust and empathy. Or does it, are we, or can we, sorry, my question is, can we always see that AI will always need a human touch moving forward to the future?
Yes, thank you very much. I think you raised a pertinent issue. AI, now this is for our own safety. AI should be that level of human touch, and that's where the regulation comes in. Like I mentioned, AI interviews that I've done, I experience more, well, should I say sympathy than even the human part. Because AI would listen to you, not interrupt you, and talk to you based on what you've said and try to, reason with you. Now, the AI is beginning to do so many things. I think there was a major fraud case in which AI actually reached out to someone, cloned the face of the either the daughter or the relative, and started a Zoom meeting with the person, so that the person, I can't remember the story in detail, so that the person actually gave out some details, whether it was account or something, until they discovered that it was a fraud. But the person had the evidence that that the daughter spoke to him. I can't remember the story in detail, but it's a recent thing. So AI, it's actually getting there, the general intelligence and everything. But one of the major concerns is that humans are well in control, regardless of the size of, we control lions, we control elephants, because of intelligence. Now, if AI agents become more intelligent than us and take over without human control, the question is, are we going to be living in cages and zoos in the nearest future? Are they going to be taking decisions and expecting us to comply? And that is where the AI ethics and regulation actually comes in. And like the CEO of Anthropic, that's the people that make Claude, has kind of called out that regulation must actually be put in place. And it should not be voluntary, it should be mandatory. So that AI does not take total control and leave us out of it. But there's a group that is trying to move into the general intelligence or the super intelligence. And that is why the Anthropic's Mythos and Fable were actually banned. Well, don't let me use the word banned, but it was controlled that it should not be released to everybody because it shouldn't fall into the bad hands. So I cannot overemphasize the regulation that needs to go into things. Thank you. I think I'll put it there put it at that in the interest of time. I think there's another hand. Okay, yes.
Sorry, can I just ask a follow-up question?
Okay.
Okay, sorry. But now when you talk about regulation, the world is not like a singular government. I feel like AI is entering or becoming another kind of arms race, where different countries are having different policies and trying to be at the top of it. Let's say between the US and China. Now, I know this not actually concerns us, maybe say medical practitioners, but I'm just asking the question. So how intelligent is trying to regulate AI? Because if you watch if I see the news right now, see what's happening in the EU now, like in Europe, I feel like they're learning hard from them trying to regulate AI because they've been left behind. The US and China are actually far ahead of them. They are now dependent. So you try to regulate AI, other people who are not so nice are getting ahead. So you fall back, and if you're falling back, you can't actually regulate something you are not creating. So it's kind of like trying to regulate it is you doing harm to yourself. So I just feel like that's one of the things that's actually affecting this regulation matter.
Okay, thanks for that insight. So, as part of my introduction, it was mentioned that I'm doing this course at Oxford. So I was at Oxford 2 weeks ago, and that was the topic of the debate. So when you say we're regulated, regulation itself, it's not bad. I mean, when you play chess, chess has its own regulation. If you put it that way, has its own rules and regulation, but it makes us to be innovative. So there is that concern that EU is actually over-regulating, and that's stifling innovation, whereas US and China are, but in US and China too, they are actually regulating. So it's part of the regulation that they've told Anthropic that this Mythos and Fable, you can't just release like that. So they're now trying to think through what should the regulation for this tool actually be. So regulation does not completely kill innovation. What it does is that it ensures that the tool does not fall into bad hands and is not used for the wrong things. So, but sometimes innovation goes way ahead of regulation, and therefore that's where you need to first of all, put a stop to things and think through how can we actually use this for human good. So, just to summarize, in US and China, they're actually regulating. They're actually regulating, but the innovation is going way ahead of their regulation, and that is why they're tending to pause certain things so that you do not inadvertently do harm. Because if Mythos is getting to the wrong hand, they can even hack into the government account. They can make decisions on behalf of the country, and it's to their own detriment. So that is being regulated in every place. But of course, there's that concern that EU is actually over-regulating and maybe it's stifling their innovation. But the summary is there's regulation everywhere. And we also have to think through it. Regulation also affects healthcare, and I think it's more important in healthcare. But the AI innovation in Africa is still at an early stage, but it's not too early for us to start thinking through when this AI really goes, full scale. How do we actually put the regulation in place? Thank you.
Thank you, sir.
Thank you.
Please, does anyone else have any question?
I think is it a legacy hand? Kuranga Victor, I think the hand is raised. Or was he the one that asked the question previously?
I can't see it, but if your hand was raised, please go ahead, ask your question. Faranga Victor, okay, please ask your question. You can unmute yourself.
Or if people are more comfortable using the chat, maybe they can ask questions using the chat.
Yes.
Then,
Right. I think there are some questions that was asked in the chat earlier. I think we were not able to respond to it. Maybe it has to do with ethics and the likes. I think one of them asks about because Dr. Innocent mentioned earlier that if you are going to use AI, you should make it transparent, like in your publication. One talked about the fact that she submitted a publication without mentioning the use of AI. So like she was asking like what's next with regard to that, will our publication be rejected? I don't know if you can just share the light briefly on that before I get other questions.
Okay. So I hacked in as an editorial board member in a few journals and also lead guest editor in one of the Sage journals. So one thing that is always emphasized that AI cannot be used, cannot be a co-author. So if it cannot be a co-author, that means there are limitations to what it should do in your research. Now, this tend to now vary across different journals. Some journals will insist that when it comes to inferential thinking, inferential insights, things that require you thinking through things, that AI should never be used in your thinking. It could be used for grammar correction. It could be used for, search. For example, if you're doing a literature review, maybe AI would help you to do the search for that, and might help you to do maybe title and abstract screening. But when it comes to synthesis, bringing the points together, maybe AI should not play a role in that. And that's where people frown. So AI has a role in research, but when it comes to thinking, particularly inferential thinking, the human part should never be left out. This is the job of humans, particularly when it comes to research. I think I can read some questions here. Concerning synthetic data, what are your concerns when it comes to authenticity? So synthetic data, it's, when particularly relevant to our own context. In our own context, the data is actually scarce. And when I say data is scarce, I'm talking about AI-ready data. AI-ready data is clean, has a coherence and things like that. But, in a place where, we don't even use electronic medical record and maybe things are not well documented, so data might be scarce. So when data is scarce, you tend to use the available data to make synthetic data.
I'm not there, but my charger is there. Yeah.
So you tend to use the available data and generate extra data. So that data can now be used to train, to train the AI models. In order for the AI model to understand the context, like, for example, maybe there's a remote area of Oyo State and they have a rare disease. When it's a rare disease, you really don't have a lot of data. So the few, maybe 30 patients you had that has this tumor, and you now begin to manipulate that data and get maybe 30,000, based on the manipulation. So that can be used to train. But as you train the model, when you're using it to make diagnosis, that's where the human in the loop comes in, because it will not be as accurate. And when the AI models now makes mistake, you give feedback to it. It's like when a student makes mistake, you do correction, and the student will now learn the correction so it doesn't make the same mistake. That's the way, the AI models are also trained. They're trained like humans. So synthetic data is not bad if data is scarce. But if data is not scarce, please look for the data in order to be able to train the model. What tools do you think fit into the work regarding AI tools? It depends on what you're doing, whether you're doing research, whether you're doing clinical work, whether you're doing, and within clinical work, which subspecialties. There are so many tools all around. So you probably need to identify which one you need and which one is actually relevant to your context, because not everything will be relevant to your own context. The question is, should you even use AI in the first place? Let me scroll down. Are there other questions? Amir or Uzoma, if you see any question that you want me to respond to, please let me know.
Yes, sir. There's one more question, I think, and they asked it on the chat group. Let me just get it briefly. Okay, someone just asked a question now.
Okay.
On the
If you
chat
could
group.
voice over it. Okay,
Okay.
concerning using AI in diagnosis, is there some data that should be kept with the doctor and should absolutely not be shared? So anything that has to do with patient identifiers, like people's name, their location, their age, that even when you remove the name and the hospital number, maybe there's only one person that is 85 years in that area. You kept the age. So when I see 85, I know that, it is this elderly man in this area that has the data that, this data refers to. I would de-identify it and know that data. So anything that has to do with identifier of patients should be kept with the doctor. So any data that will be sent or used, it should first of all be de-identified. There might be other, private data that, you're collecting and everything. That's, but any data you're going to use should also be with the patient's explicit consent. So your patient should know that you want to use this data to train a model, you want to use it and the purpose. But otherwise, you really don't have the right. You really don't have the right. I know within the setting, we use patients' data, you might just send a medical student or a house officer to go and gather case notes and begin to use data that we did not collect. I mean, that we did not get consent for. I think that's a major concern in this environment, but that should be put in place. Are there other questions?
Yes, sir. There's one more question. They was asking that as we rely more on AI for clinical decision support, how should we clearly define legal and ethical accountability when an AI assistant diagnostic recommendation turned out to be wrong?
Okay, so like I was explaining, first of all, if you're going to use AI in your hospital, there should be a governance board within that hospital. And it's the governance board, the way we do mortality sessions, mortality reviews in our hospitals. As medical student, you go for mortality reviews, and that is accountability by itself. But rather than the big consultants sitting and asking questions, they will be there, but the data governance body would also be there, and they will track things right from the developer of the model. That the developer of the model of that model that made the error, they explicitly state in their model card what the model can do and cannot do, and all the benchmarks and the data they used. If they did, then they move to the physician. What were they can there's always an audit trail of what the AI generated. So they can go to the audit log of that AI model and see what the AI generated and whether the physician rubber stamped an error or the physician saw the error and flagged it and it was the AI that made the mistake. So that structure should always be in place. Whether the physician rubber stamped or the problem was from the regulator or the hospital itself did not even put a governance body in place and just decided to be using AI without any form of accountability. So when it comes to litigation, my own opinion is that litigation should consider those key stakeholders before a decision is reached. So any of them can be found wanting based on other gaps in the management. I don't know whether that answers that question.
Yes, sir, it does. So I don't know if there's another question.
Okay, I think I can see one here. What of the inadvertent use of data in AI, for example, data collected for research purposes is published for general use, but is reused for training a model? So I think I was having this conversation with a colleague 2 weeks ago. That was when I attended a session at Oxford. So if you collected the data for research purposes, and now one of the big companies have actually approached you that they want to use this data for, training a model, and they're offering you big money, you probably need to go and collect consent from each of those patients. Because if you give it to that company, even though you did not, they did not object and everything, if there are litigations, you'll be found wanting. Because you collected consent for research. You did not collect consent for that their data will be used for training a model. And when it comes to training a model, is a commercial purpose because you might also be making money from it. So it's not appropriate. You need to go and get consent from those patients that you collected data from. I think there's a question here. And also AI model training and use in country being significantly restricted due to infrastructure and costs. Will using Western trained model like Google Gemma but fine-tuned with African data, what are the implications? So so there are a lot of people, I know there's another hand up, but I'll try and address this. So there are a lot of people that are now operating with foreign models. For example, I know Google actually released Gemma. There's Google Health, which is actually doing some great work when it comes to health models and things like that. So if you're going to use any of their models, like you mentioned in your question, yes, you probably need to fine tune it. But fine tuning is just the weight, that maybe you are altering the weight of certain things. Because maybe in America also there are a few black people there, aside the white people. Then maybe you are altering the weight, that the weight you consider the black people more because this environment is more of black people. Then you also want to come and train with the local data based on availability. So if it's a rare disease in which the data is not readily available, maybe you want to also generate synthetic data from the available AI-ready data and train the model accordingly. And the first set that you want to apply the model on for diagnosis and things like that, you will need more human in the loop. So you will need more experts to actually come and review what AI has actually done and begin to now benchmark it. So out of the 100 diagnoses that it gave, maybe 70% were right. Then you also now retrain the model based on that feedback. And you point out, just the way humans are trained, point out where the errors are and things like that. And as the model gets better, maybe you might need less humans in the loop, but there'll always be human in the loop. So that is fine. It's people now, get models into our environment, and either you're using it as an edge device in which the model is a lightweight model and you put it on your laptop or any other place, but that it must be properly trained. I think one hand is up. Lara has a hand up. Do you want to unmute yourself and go ahead with your question? Lara, I think I can see your hand. Okay. You're still muted. Okay. Uzoma, over to you.
Okay. Thank you so much, sir, for taking us time for today for this session and answering all the questions. So Amal Mohammed, the Deputy Director of Research and Publications at IMGN, will be taking the closing remarks. Amal.
Okay. Okay, sorry, there's a question that,
Yep.
sorry, before Emil
Okay.
comes in, I think this is important.
Okay, sir.
Azan has actually made a statement that I should recommend what next steps different people should take with respect to AI adoption, either as medical student or hospital. What do I have to say? First of all, I think you need to embed yourself within that space. Space of who do you follow online? It's important to follow, for example, if you're on X, which is formerly Twitter, if you're on Instagram, Facebook, many of these companies, Google, Anthropic, they're all there. So it's important to actually maybe follow them online. Then on LinkedIn also to be able to follow them. Then you'll see some of the latest discussion. Then the question is also, what do you publish either on your LinkedIn page? It's also very, very important. I know there are quite a few bodies like CCOB. CCOB is based in Lagos. I think it was established by the present minister of, I've forgotten, innovation and technology or something communication. They have this health platform where they discuss some of these things, and they have the WhatsApp group where they discuss some of these things. So it's important that, first of all, you're in that space and you're contributing as well as learning, so that when it comes to AI discussion, you are probably well placed. Now, there are a few opportunities and there are also a few trainings that actually go on, which you don't have to pay for. So one thing I do by following some of this organization is that periodically, when they're having meetings, they will post. So I would just attend the webinar, just like the way you're attending this webinar, and I'll learn some of the latest technology, some of the latest discussion, particularly as it relates to health. So I also get to learn that. And if you want to now get a deep dive into that space, then you might begin to now reach out to people that the leaders within the industry and begin to offer things you can do. Now, the African space, it's not congested. Maybe you can begin to offer opinion, AI relevant opinion regarding the African space, or even as from the medical students' perspective, what they can do and things like that. I've seen medical students that have started groups on AI and they're doing quite well. So there are quite a few things you can actually do, but I think I will leave it at that. Thank you very much.
Thank you, sir, for that.
Okay.
Thank you.
Yeah.
All right. So please, is it possible for everyone to turn on their camera for a virtual picture? All right. I'm sorry. Okay, thank you, guys. So, as we bring this insightful webinar to a close, I'd like to extend our heartfelt gratitude to our distinguished speakers, Mr. Innocent David and Dr. Abimbola Onario, for sharing their time, expertise, and valuable perceptions on artificial intelligence. The presentations have not only deepened our understanding of AI, but have also inspired us to explore its possibilities with curiosity and responsibility. To everyone who joined us today, thank you for your active participation, thoughtful questions, and engagement throughout this session. We hope you've gained practical knowledge and fresh insights that you can apply in your academic, personal, and professional endeavors. So, on behalf of organizing team, thank you once again for being part of the webinar. Hope to see you tomorrow. Thank you so much.
Thank you.